Bacterial infections of the oral cavity, classification, causes, and mnemonics. Welcome to Battlefield Mouth. Today we explored the microscopic world inside the mouth, where bacteria wage war, and you, the dentist, are the hero who restores peace. Grab your mirror, your scaler, and your notes. By the end of this video, you'll never forget the key bacterial infections again. Meet the microvillains. Inside the oral cavity, bacteria aren't just hanging out. They're forming gangs, building plaque cities, and plotting infections. Let's meet our main culprits using a fun mnemonic. Satan's pits. S. Streptococcus species. A. Actinomyces israelii. T. Treponema denticola. A. Aggregatibacter actinomycetem comitans. N. Neisseria species. S. Staphylococcus aureus. P. Prevotella intermedia. I. Fusobacterium nucleatum. T. Tannarella forsythia. S. Spirochetes. These are the key bacterial villains behind oral infections. The oral crime scene. Let's uncover what each of these bad guys do. Dental caries. Culprit: Streptococcus mutans and lactobacillus. They ferment sugars into acid, which destroys enamel. Remember, mutans make messes. Gingivitis, caused by Streptococcus, Actinomyces, Prevotella, and Fusobacterium. Plaque builds up, gums get inflamed and bleed. Mnemonic: GAP. G for gram-positive early colonizers, A for anaerobes joining later, P for plaque party leads to inflammation. Periodontitis. Culprit is Porphyromonas gingivalis, Tannarella forsythia, and Aggregatibacter actinomycetem comitans. These destroy bone and connective tissue. Mnemonic: pat attack. P. gingivalis, A. actinomycetem comitans, T. forsythia. Acute necrosing ulcerative gingivitis, or ANUG, also called trench mouth, caused by Fusobacterium nucleatum and Treponema species. Painful ulcers, necrosis, and foul odor. Risk factors: stress, smoking, and poor hygiene. Mnemonic: fun times turn trenchy. Actinomycosis, also known as lumpy jaw, caused by Actinomyces israelii. It's a chronic infection with draining sinus tracts and sulfur granules. Remember, Israeli builds tunnels in your jaw. Act fast. Ludwig's angina, a mixed bacterial infection including Streptococcus, Staphylococcus, Bacteroides, and Fusobacterium. It affects the submandibular and sublingual spaces and can block the airway. Mnemonic: Ludwig's lies low. Pericoronitis, an infection around a partially erupted tooth, usually a third molar, caused by Fusobacterium, Prevotella, and Streptococcus. Mnemonic: P for partially erupted, P for pericoronitis. Diagnosis and management. Diagnosis includes clinical examination, radiographs, and sometimes microbial culture. Treatment focuses on cleaning, controlling infection, and prevention. Mnemonic: C-A-R-E. C. clean the site. A. Antibiotics if needed. R. Remove the source. E. Educate the patient. Quick summary. Let's recap. Streptococcus mutans, dental caries. Actinomyces, root surface caries, and actinomycosis. Porphyromonas, tenorella, and aggregatibacter, periodontitis. Fusobacterium and treponema, ANUG. Mixed anaerobes, Ludwig's angina, and pericoronitis. Main mnemonics to remember: Satan's pits, oral pathogens. Pat attack, periodontitis trio. Gap, gingivitis stages. Care, management steps. Quiz time. Let's test your knowledge. Question 1. Which bacteria is most associated with dental caries? A. Porphyromonas gingivalis. B. Streptococcus mutans. C. Fusobacterium nucleatum. Correct answer: B. Streptococcus mutans. Question 2. Trench mouth refers to which infection? A. Periodontitis. B. ANUG. C. Ludwig's angina. Correct answer: B. ANUG. Question 3. Which infection causes sulfur granules? A. Actinomycosis. B. Gingivitis. C. Pericoronitis. Correct answer: A. Actinomycosis. Question 4. The mnemonic PAT attack stands for what? Answer: P. gingivalis. A. Actinomycetem comitans. T. forsythia. Question 5. Ludwig's angina is an emergency because it can obstruct the what? Answer: the airway.